demonstration again, a walkthrough on Nishauri. We will be sharing with you a generic work plan that we believe will work. And of course, we will share with you again the value proposition for Nishauri. So without wasting much time, I would like to request Moses Care to take us through the first session on the value proposition, which is the overview for Nishauri application for those who are yet to experience this. Moses?
Thanks, Ajua. Just a minute. Ajua, confirm that you can hear me first before even I think of sharing my screen.
Yes, you are audible.
Thank you. And also confirm that you can see my screen. Is my screen visible to all?
Yes, we see your screen.
Thank you. Now I'll just want to be brief, and mine will be to just give a brief overview of what Nishauri is all about, highlighting the value proposition and probably what it takes to just have a Nishauri. So, like I said again, one, just giving the overview of Nishauri, well, and what's the purpose of Nishauri. I'm sure by this point in time, a majority of us have already heard about Nishauri. I've interacted with some few individuals out there in the field, and they were like, they were telling me that we are confusing them with the way we are naming some of our products, because now there's Ushauri and then Nishauri. But I mean, if you understand Swahili, like my friends from Coast, they'll tell you that Ushauri and Nishauri are two different words. Because Ushauri is more of words of wisdom, and the Nishauri is now, can you advise me? Now it's more of on a personal level. So what is the Nishauri? Nishauri is a patient mobile application used as it's actually as a health journal, and also enables the. Please, if you are on.
Oh, madam.
Ajong, you'll help me with the muting of those participants that are joining in, and please just assist. Okay, so like I was saying, Nishauri is a patient mobile application used as a personal health journal and also for engaging with providers. Why personal health journal? Because it is more of what I can say, a digital e-card. It avails to the client information pertaining to their healthcare and how they have even been they've been faring on treatment. Please mute if you are on. The people on who are having their lunch and they're not muted. Please mute. All right. So it is more of an e-card that gives the client more information pertaining to their how they have been faring on care and treatment. And just to mention but a few, it supports patients to sit at the center of care coordination, and it enables them to be empowered in their care decisions. I will be delving in this much more deeper when we'll be looking at the value proposition of Nishauri. It also aims at providing the client with a history of their appointments, not only present and future, but also even their past appointments. So that you're able to, as a client, they're able to follow up, and even the care provider can tell from the app how this particular client has been adhering to their appointments. And also, it's a client. It also enables the client to reschedule their appointments from their application. Kajwang,
yeah, he's muted. Moses, just carry on. Moses?
Moses, you are muted.
me. Ajuang, I think you muted everyone, so you in the process you also muted me. So
Sorry.
just identify the guys who are making us to go that route. All right, let me again reshare my screen because I had to unshare and. All right, confirm that you can hear me and that you can see my presentation again.
Yes, we can.
All right. So my last point here was that what I was trying to explain was that a patient can view a trend analysis of their progress in relation to their adherence to appointments while viewing their dependent lab results. And by this, I'm sure we'll be showcasing today the various lab results that are available on the Nishauri platform, which are picked actually from the facility EMR. Nishauri value proposition. In looking at these, I'll want to look at these in 4 facets. And these are one, continuity in care. And under continuity in care is actually from the increased knowledge and positive attitude towards their personal health. It actually helps these clients who have this app to just ensure that they're able to, one, adhere to their appointments and not miss out on their clinic appointments. So this in essence actually helps in ensuring that continuity in care is actually achieved. And then 2, like I said again, adherence, the better personal decision making on health performance. This is based on, just the fact that they can be able to tell whether see that the trends of the way they adhere to appointments. It is also this is critical because like I mentioned again, once you're even given the opportunity to be able to reschedule your appointment, it will help you adhere well in have a good adherence to care and treatment. And then data use, early informed personal decision making based on the data accessed. So it actually empowers the clients themselves to be able to, make use of the data that is available at their disposal. We're talking of the viral load results and even their adherence to appointments. And other than that, I'm sure there are plans of us churning out just the wellness messaging through this particular app. It gives and enables our clients to be better informed and just have access to data that previously wasn't accessible to them. And then lastly, empowered clients. So Nishauri enables our clients to be empowered in the sense that it gives them, it enables them to be actively involved in their in some of the decision making that affect their care and treatment. For example, a good case in point is where probably a viral load has been done and then the client is probably is viremia. So, this information will get to them firsthand, and I'm sure from the Nishauri dashboard, they will be able to know what are the next steps of action that they are supposed to be taken to ensure that this is improved. All right. I want to just look at the Nishauri features, and as I do this, I'll want to look at it in 2 fronts. One, the functionalities, and then the benefits of the program. So one of the functionalities, the client can easily get and access their unique ID, the name of the facility, phone number, and the drug collection point. Why am I saying this? Why is this important? This is important in the event probably your client is out, they have traveled somewhere and they didn't carry their card, their clinic card. Actually, with the Nishauri, they can just avail this to any other facility where they will want to probably pick a drug refills, and this will come in handy because from here, the care providers in the other facility will be able even to see the regimen that the client actually the client is in, and also the last time they were given medication, and even their viral load results, because all this is available on the dashboard. And then the dashboard trends based on appointments and lab results. Actually, any other client will want to ensure that their trends, the trends of their appointment trends on their dashboards are what you can call as ideal. So this one, in some way, helps them to just be adherent to their clinic appointments and ensure that they don't miss out on their scheduled appointments. And then the appointment management view, they can view the upcoming appointments, request the rescheduling of existing appointments, like I mentioned. And something that probably is not easily available for clients who will not be having this app, because rescheduling an appointment sometimes calls for a client to call the facility, and this can be done, I mean, just from the app. Then, like I said, lab results, they can view the personal and dependent lab results at the tap of a button, be it their VL and CD4s. And then, I mean, this is also some, if you ask me, it is some motivation factor to a client. And dependent management here, for clients that have dependents, for example, our PMCT clients. So our HIV infants can be added at the tap of a button, and then we can manage them from the app of their mother. We'll be showcasing this as we do the demo. And then Nishauri also provides resources, some resources portal where a client can view what you call as frequently asked questions. And also, going forward, we are intending to actually utilize Nishauri in conducting client satisfaction surveys. Just to leverage on what we are doing on P-Survey, we'll want to be able to be doing surveys from Nishauri. Not forgetting the chatbot that enables clients to interact with the bot to get more information about their care in package. So under the bot, we have our developers have just tried to list some of the commonly asked questions pertaining to care and treatment, HIV care and treatment, and therefore clients, once a client types something about, let's say, viral load, they are given information pertaining to probably a low viral load or what a high viral load means. What are the benefits of Nishauri to the program? One, all the programs are clients who are actually utilizing Nishauri will actually have ensure that their supported programs benefit from these from the benefits that I'm going to list. One is the reduced turnaround time of transmission of results from the testing labs to the clients. You realize that Nishauri actually overrides on MLab to just pick and also lab manifests from the EMR to just pick the lab results, especially the viral load, as soon as they have been processed. So this is available to the client. And then matching of results to the please mute, matching of results to the clients or patient during transmission. So this is will also enable programs benefit from that. And then again, return to care will be made easy because and also the tracing of clients who probably are IIT and they have this particular app. You can be sending probably just messages to them, and then they'll be able to just trace them back to care. You can also engage your client through surveys to better understand their needs, like I mentioned, so this will in one way probably benefit the program in the sense that they'll be able to know even their client satisfaction by conducting client satisfaction surveys. They'll be able to know on areas where they need to improve. And then definitely programs where clients are utilizing Nishauri are definitely going to benefit from reduced missed appointments and ease in management of the DSD clients. So I'll want to end there, and Asha Marianne, who will be taking us through the Nishauri demo.
Thank you, Moses. As you put down your presentation, confirm I am audible.
I can hear you well, loud and clear, Miriam.
All right, so for now, let us take some time to go through the application. And as I do that, I'm going to put a presentation for this. We'll go through the Nishauri application. And while we are doing this, we'll be answering two pertinent questions. One of the questions is how to access the Nishauri application, and two, how to use the Nishauri application. So as we have gone through the introduction bit, Nishauri application is a mobile health application that is used via smartphones. And how do we access this particular application? Currently, the application is hosted in Google Play Store, and we can be able to download and install in our mobile phones. So how to access the application? We'll go to Google Play Store, search for Nishauri. And we're going to select this particular Nishauri app that is developed by Palladium. It has a dialog box with blue-green colors. And inside it has a Pulse Line logo against the white background. And we can be able to install and open this particular application. So when you go to Google Play Store, search for Nishauri by Palladium, ensure that is the application you're downloading, uniquely identified by the logo, the name Nishauri, and the unique logo that has a dialog box with green-blue colors inside with a Pulse Line. So once you're able to download and install this particular application in your mobile phone, it will appear among the many applications that you may have in your particular application. It is a very light application. The current version is around 8.9 MB, so it will not take up much space. And you can be able to open the application. For this particular demonstration, allow me to use an already installed version of that application. So when you open the application, it takes you to the landing page. And after accessing the landing page, where it gives you now the application logo, it takes you to the login page. At the login page, a user can be able to access the application in three particular ways. One, as a registered user, whereby you will be required to input your phone number and a password. Two, you can be able to sign up as a new user who had not previously been registered before. And three, you can also access the application as a registered user who has forgotten their login credentials. You cannot be able to remember the phone number, the password that you used for the particular phone number. So we are going to go through quickly these three particular ways of how to access Nishauri application. We'll start by signing up as a new user. So for us to be able to register to Nishauri as a new user, we are going to use the new user link, sign up here below. We're going to select that. And the application pops up a small registration form. Kindly mute from your end. There's some noise from the background. For this particular sign up, the application requires very few details from a user. One is the email address for a particular user. You need an email address so that you can be able to access the application from Google Play Store. But it's not really being used so much within the application. Then you need a specific phone number. And this is the phone number that has been registered in the EMR system, where we're getting registration details for a particular patient or client. That phone number that we have registered that user with is the same phone number that you're going to use here. There's an echo. There's an echo on my end. Any participant who is near me, kindly mute from your headphones. Thank you for that. So again. Okay. So we're going to do this practically. So please provide a complete email address. Give the typo in the description. So I'm going to use my email address for this, a specific phone number. And remember, this is the phone number for the patient as it has been registered within the EMR. Then the system will require you to enter a password that you can remember. And as you're typing the password, you will notice that the system also prompts you. The password that is allowed should be 8 characters or more. I'm going to get a password that has 8 characters. Then we re-enter the password again. And you'll notice that if you enter something that is not applicable within the application, it will be highlighted in red. And once you complete it successfully, it will give you a blue highlight on a particular field. To confirm the password, you can be able to just view, just to confirm that you have a matching password. And we can now proceed. So what is required for registration or signing up as a new user is a unique email address, the specific phone number for the particular client has registered in the EMR, a password that they can remember that is 8 characters long or more. And before we register, we need to check the confirm. We need to check the confirm checkbox. And before a user checks, it's always recommended that we just review the privacy terms and agreement that has been put up. For this particular instance, what is available is the user privacy information, just detailing or giving some specific instructions on how a particular user can be able to secure their data more in terms of not to share the password with any other person. When setting up a password, what is required, what we've just gone through, we need 8 characters or more, and what the password should contain, numbers, lowercase, and so on, and limit the number of devices where you're using this application just to ensure that we do not expose personal data to unauthorized access. So once you review the privacy information and you're good with it, we can be able to check and confirm that you have read. Again, we'll be reviewing this more within the application, and now we can be able to register. So when you do that, if you have already registered in the application, definitely it is going to give you a warning showing that the user with a similar phone number already exists. So we need to register a totally new person. So we can use a different phone number for this particular demonstration. And we can register. So once you register, the application redirects you again to the login page. And now you can be able to log in with the phone number and the password that you have just signed up with. So I'm going to use the same phone number, 0725 456 789. And if for any reason I am not able to remember my password, or I input the password and the system gives you an error showing that wrong password provided, and a user cannot completely remember the password that you used during sign up, then you can use the forgot password link. So when we select the forgot password link, it enables us now to be able to reset that particular password. You can either give the email address that you had used to sign up with or the phone number. So for this instance, I'm going to use my phone number. so that I can get the opportunity to reset my password to be able to log in. Then you can now select the reset password link. So when you do that, the system now sends a one-time PIN to the phone number that you had used to sign up. Again, this is also a security measure. So that means going back to the phone among your messages just to confirm that you have received an OTP sent by the application. My OTP is 57569, and I can go back now and be able to input that particular OTP, 57569, and we can submit. Once you do that, now the application will allow a user to be able to reset the password or to input a new password. So I'm going to input a new password. I'm going to use 12678 for the sake of demonstration. And again, I confirm that the passwords are matching and I submit. So when you do that, the application will tell you that your password has been reset successfully and you can now go ahead and log in. So we've been able to go through the sign up process where a specific email address and the phone number used to register this particular user within the EMR has been used, and a password that they can be able to remember. We have also seen that you can be able to reset the password using the forgot password link if you forget. So now let us try to log in so we can go through the application. So I'm going to use my phone number for this. So once you put the correct password and you log in, the application now is going to allow you to fully log in to the application. So when you do that, the application now directs you to the application homepage. And we are going to go briefly through the homepage first before we get into the specific modules within the application. So for this, let us look at the application homepage, starting from the top where we have now the specific. We have two icons. We have the three dots icon. Starting with that, I want us to start from the top, in the middle, vertically and horizontally. So we're going to start at the top. So for the two dots on the left side at the top, a user can be able to now log out of the application if you have finished your particular session. So this is where now you log out of the application. Then on the right side at the top, we have a burger icon that has three small lines. And for this, again, it shows a vertical view of the modules that are available in the application, starting with some bit of the patient profile or the user profile, showing their name, the CCC number, the facility where they're currently attached, where they are being taken care of, now showing the menu for the particular application. That is the homepage, the dashboard, results, appointment, the resources, BMI calculator, and about the app. So we'll be going through all these particular modules one by one, just to understand how they are used. Then again, you will notice in the middle, we still have the same. We can be able to view the CCC number of our patient, their phone number, and the facility where they are attached. As well, we can be able to view specific upcoming appointments for a particular patient, the current regimen that they are on, and any dependents that they may have, if they have any particular dependents. Then on the horizontal view, again, you'll find a repetition of the same applications that we'll be going through: the homepage, the dashboard, the lab results, the appointments, and the resources page. So for this particular demonstration, allow me to use the vertical view or the slider view for this. So down here about the applications, when you select settings, the application will allow you to be able to view the terms and conditions, the privacy agreement about this particular application. So let's start with the application. When you select, it gives you an overview of the application name, the particular version that you're using, the build number, when it was built, and what the application is about. For this instance, we are viewing the Nishauri application, version 2.2, build number 50, that was last updated in October 2020, and shows you a brief overview of what the application is. Then when you go back, we can as well be able to access the same privacy policy that we had accessed when we were signing up in the application. Further, what has been provided are now the exact terms and conditions that a user should just go through so that you can understand, one, the data that is being collected, how it is being used, what are the limitations, what are the prohibitions, what is being allowed, and so on. And we can be able to see this in depth using that. So let's go back so that now we can be able to go in and delve further into the application, starting with the dashboard. So when you select the dashboard, we can be able to see a summary of appointment trends showing in terms of missed appointments that a user has either missed, and the appointments they have also kept, as well as currently booked upcoming appointments. For this particular user, they've had 28 appointments. Out of them, 7 have been classified as missed and 21 have been kept. Then further, we'll be able to see now an analysis of the missed appointments. So out of the 7 missed appointments, what category were these particular missed appointments? And all of them were for a clinical review. So depending on the missed appointments that a client may have had, maybe they did not come for a refill, they did not come for a lab test, and so on. This analysis will be available for missed appointment by type. Then down here, we'll be able to showcase the lab results trends for a particular patient. A client can be able now to access. Please kindly mute from your end. Thank you. A client can be able to see lab results trends over time, particularly for viral load, where
Miriam, please unmute.
I think someone mute.
Can we confirm at what point somebody muted me? Okay, then we can continue. Moving on from the dashboard, let's look at the lab results. So at the lab results, this is where now a client can be able to request for viral load results of lab tests done using the request results button, this one here, request results button in blue. When a client presses this button, what it does, it pulls all results attached to their CCC number from the MLab platform directly from the reference lab, meaning we are getting results as they have been processed from the various reference lab and posted in the MLab lab manifest dashboards. So when we do this and a patient has particular lab results, either past or current lab results that have been done for this particular patient. Then for the appointment section, this particular module has 2 views. We can be able to see upcoming appointments and previous appointments. So upcoming appointments is where we can be able to see any future planned or booked appointments by type and date. And this is where a client will have the ability to request for an appointment to be rescheduled, and we'll be able to see that with a patient that has data. Then for previous, this is where now we'll be able to see all previous past appointments by type. What type of an appointment was it? When was that particular appointment? and what was the outcome? Did the patient keep the appointment? Did they miss the appointment, as we can be able to see? And moving on to the other module for resources. Now, this feature allows clients to be able to access particular useful tools that they can be able to use on need. For example, we have the ART directory that allows a user to be able to search for a particular facility details or contact details. For example, maybe a user is on Transist and they would want to know facilities within Machakos where they can be able to access care, or just search for a particular facility name just to get to know, to get the contacts of that particular facility. When you select search, using limited facility name or just using one name to try and get facility data gives you all facilities that have that particular name associated with them. So I searched for Machakos and I was able to get Shalom Community Hospital Machakos, Machakos Level 5 Hospital, Jirani Diagnostic Center Machakos, and so on. So any facility within Machakos that has the name Machakos will be displayed by this application. So what will be displayed is specific contact details of this facility, the facility name, the MFL code, the type of facility, and the phone contact for that particular facility. So a user can be able to call and inquire on a particular need, either for care or for a drug refill. Maybe the patient is on Transist and so on. So when they select the call button on any of the facilities that we may have chosen, we may narrow down our search. So when we narrow down our search to a particular facility, let's just use another facility. If we narrow down to a specific facility, maybe a particular user or client was searching for Machakos Level 5, you will get particular details for that facility and they can be able to call. So once they press the call button, the application will now activate the call function from their phone, input the phone number for that particular facility, and they can be able to go ahead and call that facility for whatever need that they had. So let's go back. The other functionality we have among the resources is you can be able to chat with a healthcare worker. And when we select this, a particular user will be able now to start a conversation with a chatbot that has been trained to be able to answer specific questions using the frequently asked questions that we have. So for example, a user may just start an interaction with a healthcare provider with a greeting, hi, and the application is going to answer back, hi, what's on your mind today? And then the user can ask, how do I use Nishauri? And you'll find that the application is going to give various responses. For now, this application is still under training. And for this instance, I'm using a test APK, but for the real application that is in Play Store, that is accessible by users, you will get that it has been well trained with the particular frequently asked questions that we have. So if a user again may want to directly ask a question that is already known, They can use this particular section for frequently asked questions, and they can go through the list of questions that they may have. If it relates to what they want, they can be able to check. For example, they may want to know what is low detectable viral load, and we can be able to get that particular response by pressing the down arrow, and we can get that it is any viral load result that is below 50 copies. What is a high viral load? Again, we'll be able to get a response that it is a high viral load of any result greater than 200 copies, and so on. So they can be able to get assistance on how to navigate the applications from the different modules that you have and the different use cases from the frequently asked questions that have been captured. So the three tools are quite useful, and this is what has been put under resources, and they will be of help to the user. So then the last module that we need to go through is the BMI calculator. For this one, it allows a user to calculate their BMI by allowing them to input their current weight in kilograms and height in centimeters. And we can do this practically. For example, I can just input a weight of maybe 80 kgs, a height of 162 centimeters. And with this, we can be able to calculate this particular BMI by selecting the link of Get Your BMI down here. And you'll find that the application is going to calculate BMI using the BMI formula, where we calculate weight in kilograms divided by height in meters squared. And we get that the BMI for this particular user is 30.48, and the BMI categorization is obese. So with this kind of information, a user now will be able to get further support from the clinical team, so that they can be advised better on health, lifestyle choices, and how to improve on their BMI in terms of their nutrition, diet, exercise, and so on. So this is just to inform a user that your current categorization may not be okay, and you may need to do something depending on the BMI calculation. So that is a brief overview of what is inside this particular application. So allow me to go back to the login page so that we can log in with a user who has some bit of data, where we can now be able to see specific functionalities within the application for this. So for this particular setup, please, if you're talking and you're unmuted, kindly mute. So I'm going to use a test mobile number for a test patient to be able to log into this. And I would like assistance from my colleague on the call. Kevin, give me a phone number and a password that I can use for this. Kindly unmute from your end. Kevin, you be on the call.
Hey, Marianne, what was the
Yes.
request?
My request is I need a user who has data within the Nishauri test application. The user was currently using does not have anything, and we need to briefly repeat some sessions. So allow me to use a patient who has some data, and I will be able, one, to reschedule the appointment within the application. I will also be able to set the program within the application, and I can be able to visualize some bit of data from the dashboard.
A minute. So Miran, which patient are you currently using?
Using phone number 0723-739130.
No, the patient CCC number, sorry.
Sorry? Unfortunately,
number for the patient.
this particular phone number at login skipped that section, so I would not use a CCC number. That's why I need another one.
Yeah, so the 001 is still available.
And the same phone number. So this particular phone number is attached to 18415000111, which does not have any data, and it is keeping a very vital section for the showcase.
Okay, you could clear your cache, or I could project mine and then you go through using my phone.
Yes, please project from your side. Let me just share. Okay, go ahead and share.
It's in the process. 1 minute. Sorry, it was already shared. I was wondering what's happening.
Kevin, we lost you. Kevin, we can go ahead. You okay?
Sorry, Marianne, could you, are you able to take us to the portal as Kevin checks up on that particular client? Because you can't hear him.
One
Okay.
minute, John.
Okay, so I guess we can take, I see 2 hands were raised. Maybe we can, I'm hoping you're not asking, you can't hear anything. Masimba? Masimba, go ahead. Okay, I think that was a false one. Carol? Kevin?
Yes,
Okay,
John.
good. Thank you, Bernard.
My phone was knocked out of the meeting. I'm just trying to readmit it.
Okay, that's
Okay,
fine,
good.
Kevin. We have another Kevin on the line. Let me just hear what
Oh, sorry.
Kevin Mugo has to say. Yeah.
Okay, thank you, Bernard. So mine is just to really thank Palladium team for the good work that you're doing. And I think Nishauri will actually go a long way in supporting the patients that we are supporting in the facilities. So just a quick one, I think on the chat, how does the chat really work? Do we have like an admin at the facility that will actually be responding to those chats, or there's a centralized sort of admin who responds to the chats? And then also for the part of configuring the Ushauri to connect to a specific facility, how does that happen? Because I think I either skipped it or I did not see that, because I think we registered a patient with a number, but we really didn't see how we are linking that patient to a specific facility. Thank you.
Okay. Thanks, Mugo, for that. I'd like to ask Marianne to just elaborate on the chat. I believe we're using an AI-enabled chat, but Marianne will give more details. Then Kevin Lanyo, perhaps you can elaborate on the integration with Ushauri from this particular application. Marianne first. Okay, Kevin, are you back?
Yes, I'm back. You wanted to answer on an integration with Ushauri?
Yes, please.
In terms of the IL integration, I missed that part.
Okay, so the question is, we've just signed up a new client on Nishauri app, and there is a need for integration with Ushauri for purposes of appointment reminders and the like. So Mugo is asking, how does that happen? Does it happen automatically once you already signed up on EMR and Ushauri and you're created here, or do you have to set it up deliberately?
Okay, thanks. So number one, Nishauri does not have data of its own. Nishauri uses data from other systems. So the other systems are the Kenya EMR, Ushauri, MLab, Afiastat, all the other systems that support the care and treatment of the patient. So what Nishauri does is to pull all that data into a medical record that can then be shared with the client. So if the client is in the EMR, their data will appear automatically in Nishauri. If they were registered on the Ushauri platform, again, their data will appear automatically in Nishauri, and all the other systems that support the care and treatment of the patient, and also as the appointment management. So that's how the data eventually comes to Nishauri. So on your end, all you have to do, if you're on the KenyaMR, is to switch on the IL module, integrated Nishauri module, and your appointments and registration information will be shared across automatically, and your clients will be able to be enrolled to start using Nishauri. Over to you, John.
All right, thanks. I would like to ask, there's someone, Kasusu. Could you voice your questions? I see that you have 1, 2, 3 questions. Perhaps you could just voice it so we can respond as we set up the next part of the demonstration.
Okay. Thank you very much. I hope I'm audible.
Yes, you are.
Okay, thank you for the presentations. That is the Palladium team. I have several questions that maybe need elaborations, and one of them.
Wait, someone muted Katsusu. Oh, okay. I think we'll get to later.
Sorry, I'm back.
Okay.
Yeah, what I was saying, one of the issues that I need a clarification is how the clients do rescheduling of the appointments in the app. Maybe I might have missed that. Then the other one is about does the Nishauri app give alerts to the clients about the appointments, maybe clinical appointments, or maybe like VL testing appointments? Apart from them checking, does it give them an alert so that to remind them on those appointments? Then apart from chatting with a bot, is there an opportunity for the clients to chat with their case managers from the facilities for a real-time maybe advice, counseling, and the like? Then maybe again the developers can tell us what is the way forward for the non-EMR sites for this particular Nishauri. Then there's somebody who asked about the email address. Is it a prerequisite for the clients to be registered in the Nishauri app? Maybe that one can also be elaborated. Thank you very much.
Okay, so I guess I would like to request Kevin to take some of those. Then you can defer to the rest of the team to respond.
Okay,
I think
Sam.
I'll just take one, which also confirms Mugo's question around the chat. So as I said, the chat is an AI-enabled chat. We are expanding it to be able to respond to all the common questions. And so you are currently not chatting directly with someone at the facility, but you are chatting with a common body of information that's collected from the common care and treatment info pack. Yeah, so Kevin, you can take the rest.
Yeah, so for the email, you can be able to. Sorry, just a moment.
It's muted. Go on.
Okay. So for the email, what it's used for is for the login. A notification can be sent to you directly in the chat when your appointment has arrived. So you have the in-app notifications for you to be able to get notifications for your appointments. And then you also asked for the non-EMR sites. So for the non-EMR sites, you can be able to use the Nishauri platform directly. And from the Nishauri platform, you'll be able to register your clients, and the information will be available to Nishauri for them to do enrollment and to use the application. So if you're on an EMR site using the mHealth applications, Nishauri, mLab, and all the rest, all that information will be available to you in Nishauri. Over.
All right. Thanks, Kevin. So I see some questions that are already preempting the remaining part of the demonstration. I would like to request that we complete the remainder of the demonstration, and then we can take some final questions at the end. So Kevin, you can carry on. Kevin?
Yes, John, my phone is unable to join the sharing. So I'll request Miriam to please pull up your application, and then I'll give you a phone number to register with.
Just a minute.
Okay, so as Marianne pulls up, I would like to take one last question for now from Stephen Obala.
Thanks, John. So mine. Once again, thank you for that nice presentation and good innovation in regards to addressing some of the issues that we have with clients. So mine, I know some of them have been answered. So let me just go to the last one. In regards to the integration, I don't know whether I picked it wrong, that for the viral load, it will only pull for NHRL. And I also wanted to ask if at all it will also take from the EMR, which is also being used to manage this particular clients and not just from the reference log, because this VL has not reached the facility for management purposes. And then the last one, I don't know if I get it wrong, for the chat box, are you able to chat with a facility staff directly without using the information in regards to the pre-populated information in the system? And not calling, just chatting a bit of it. Thank you, and over.
Okay, yeah, so I see the question on chat is still recurring. I guess what is emerging is that the need for this function to chat with the case manager is now an enhancement need that, if I'm hearing correctly, this is something that the users would like. So it's something that I guess we are going to prioritize alongside the other previous requests that came through. But for now, that feature is not available, as Marianne had shown us all the functionalities that are there. Again, you asked about the availability of the lab results before they are available to the facility. We are all moving towards the automatic the remote login and automatic pull for the lab results. So that means these results, once it's available, will be streamed to the facility and also to the user at the same time. So it need not get to the facility before then it's relayed to the user. The moment it's available, it will be it can be pushed to the client and it can be pushed to the facility whenever their internet and their request is made. I don't know if I've covered everything. I would like to defer if there's anything else. We take this. Marianne, please carry on.
Yes, thank you, Ajahn. Apologies for the small hiccup. We were using a test server, and now when using a test server, things happen. So confirm my screen is visible from your end.
Yes.
Okay, so we can proceed. So I'm going to use a different user to log in so that we can go through some of the key things that we had skipped. And upon logging in, so we're going to just to do a brief recap so that we can be able to see some specific things that we had not been able to capture before. So starting with the homepage, remember we said the homepage is giving us some bit of the profile details of the patient, the SSC number, the ANUPI number if it has been captured, the phone number, and the facility where they are attached. Then we can be able to see the upcoming appointments, the different appointments, futuristic appointments that have not yet been kept, that they are due to come, their current regimen, and the dependents. So we'll go through for each. So for example, for this particular user, they have 2 upcoming appointments, a refill appointment scheduled for August 10th and a clinical review appointment scheduled for August 10th as well. If for one reason or another, this particular user may not be able to make it for this August 10th, something comes up, either at work, at school or something, and they feel there's a need to reschedule, using this pen button here, they can be able to request for rescheduling of this particular appointment. Remember, a user can have different appointments. They can have a refill, a clinical review, a lab appointment, an adherence appointment, and so on. So whichever appointment they feel they may not be able to make it on time, they can be able to request for a rescheduling. So we're going to reschedule maybe for this refill appointment, date scheduled for August 10th. Me as a user, I feel I am not able to make it for this particular appointment because of one reason or the other. So I would request to reschedule it from August 10th to maybe I'll be available on Thursday, August 24th. And the reason why I am rescheduling is because I will be out for work. Not available on August 10th. So with that information, what I'm doing is that I'm requesting my facility or my clinical providers at the facility where I usually I'm taking care of from to reschedule this appointment, and we can be able to continue. So when you do that, the application will update it and you'll find that now we have a reschedule that is pending approval. And we'll be able to see now from which platform this particular message reaches the healthcare workers so that they can either be able to approve or deny this particular request. Then for the current regimen, we have the current regimen displayed for a particular patient. And when you use the drop-down menu, we can be able to see just an overview of what this regimen is. Our patient is currently on ABC 3TC efavirenz. This is a fixed dose combination, ARV medications. The combination consists of this particular medication, and in case of anything, you're advised to contact your healthcare provider further. So why would a patient need to see the regimen they are on this particular application? One of the reasons is one, in case they may be on transit and they need to refill, it's easy for them to be able to remember the regimen they are on, or by showing the healthcare provider in another facility, this is the regimen I am on. So they are not confused or given a medication that they do not take. As well, in case they develop an advanced drug reaction, it's easy for a healthcare worker in a facility maybe they have visited to be able to tell what kind of drugs this patient has been on that could have caused such kind of an advanced reaction and so on. Again, more functionality will be added in future for this particular section so that we can capture more functionality as will be guided by the users on the ground. Then for the dependent sections, this now gives a list, just a list for now, of all the HE or patients under 2 years that a particular patient may have, showing their name, their age, and the CCC number. And probably they're also attached to this particular user within the within the CMR. and they also attend this particular facility together. So that is one of the things we may have missed. The other one now is from the dashboard, whereby from the dashboard, we will be able to see specific trends for appointments, looking at now appearance over time in terms of appointment. Out of all the appointments they've had, how many can be classified as missed, how many they have missed, how many they have kept, and how many appointments so far they have not yet attended that are booked. We've seen our patient has a refill appointment. They also have a clinical review appointment on 10th. We have tried to reschedule one, so they have 2 booked appointments. So far, they've had 7 appointments. They have kept 2. They've not kept 3. So we can see the statistics over time of the appointment trends. And for the missed appointments, again, we go further and give some bit of analytics. What are these? What missed appointment did they miss? What type of an appointment did they miss? So for a patient, they have missed 3 clinical reviews. For the 3 missed appointments here, we are classifying them as 3 clinical reviews. Then for the lab results, we can be able to visualize trends over time, whereby for viral load results for now, on the left is where we have more recent viral load trends, showing the viral loads that have been done over time and whether they have been suppressed, the copies over time. And on the left is where now we have past results, visualizations, and we'll be able to see this for as many viral loads we have for a specific time period for a patient. Then when we come to the lab results, this is where we have the request results feature, whereby a patient can be able to select and request for any available viral load results that we can be able to get directly from the reference lab, marked to the MLab and lab manifest servers. And this now is pulled from there. And we can be able to see the most recent viral load in terms of the copies and whether the patient has been suppressed or not, and any other viral load results that they may have had over time, and whether what was the result, was it suppressed, not suppressed, and what was the actual copies for that particular result. So this will be able to display for a particular patient for each. And again, now using the drop-down menus, a user will be now kind of advised on what is a viral load, what is an unsuppressed viral load, and can be able to see. And they get some clinical guidance on maybe if your viral load is unsuppressed, this could mean this is the beginning of treatment failure, and you may need to urgently visit your healthcare provider. So this is just a guide to the patient. Again, if they are virally suppressed, just giving an encouragement to them that maybe they are adhering to their treatment, and they should continue taking the medication as they have been advised by their healthcare providers. Then when we go to the appointments section, again, we have 2 use cases here. We can be able to see any upcoming appointments and previous appointments. Remember, a patient has 2 booked appointments, a clinical review where we have requested for a rescheduling and a refill, and we can be able to see them here among the upcoming appointments. From this view as well, from the appointment module, a user will also be able to reschedule in case they will need to reschedule a particular appointment by requesting, inputting a specific date and date when they feel they will be available to come for this particular appointment, and the reason why they will not be able to attend the appointment as it has been set prior. Then for previous, now this is where we're able to see any previous appointments our patient or client may have had in the past, the type of appointment it was, the date, and what was the outcome, whether they were able to keep that appointment or they missed. For example, our patient has 1 refill appointment and 4 clinical review appointments on varying dates. They were able to keep 2 appointments, kept 1 refill appointment and 1 clinical appointment, but they missed on 3 clinical appointments. The other one for the resources section remains as we had gone through before. Those were the only key things that I wanted to highlight that we may have missed using the first test patient that we have used. So when we reschedule this particular appointment, how will the healthcare worker in the facility know? For our patient, their CCC number is 12345, patient 1. They're in Kasikeyu dispensary and they have requested to reschedule a clinical review for August 10th to August 24th, and it is pending approval. So as a healthcare provider, you will be able to visualize this request coming from the Nishauri application from different patients or clients that you have in a facility from the Ushauri dashboard. And that is where we were saying that Nishauri is being linked to the Ushauri dashboard. Just allow me to be able to project that. Confirm that my screen is visible. Somebody confirm.
Yes, Marianne, it is visible.
Okay, so from the facility Ushauri dashboard, provider will log in to the Ushauri dashboard using the particular credentials that they have, and they'll be able to access the dashboard or the data for that particular facility. So from the dashboard, once you log in to the Nishauri, you'll find at the top corner, top left, top right corner, where we have an icon of an email or an envelope indicating a message or an email has been sent. And once we select this, we have 3 messages that have been sent to this particular facility, whereby specific healthcare workers should open and visualize what the messages are. So when we open, this is where now you find any request coming in from the Nishauri application to reschedule a particular appointment. This is how it will be sent to Nishauri, to Ushauri from Nishauri. Showing now the patient name, their CCC number, the initial TCA date of or next date of appointment that they had been given, and the proposed date that is now coming from the application, and the reason why this particular client is requesting to reschedule. So some of the actions that a healthcare provider can undertake is they can be able to approve this particular request or they can reject. So when we select approve, for example, for this particular, let me use our patient. Our patient was 12345, patient 1. This is a test server, so it will not particularly show Kasikeyu facility where this patient was attached. We had said that the reason why we want to reschedule from 10th August to 24th August is because the client will be out of work and they will not be available on 10th August. So as a provider reviewing this and considering that maybe this patient of yours has been adhering to their appointments, maybe they're even on a DSD mode, they are on a DSD and they have not rescheduled for so long, the number of days from 10th to 24th, you may feel like it's okay, you can be able to approve this, so we can select approve. So when we approve, this approval is being attached to this particular CCC number, changing the appointment date previously from 10th to 24th, and we select approve. And now Ushauri application itself will be able to tell you that the date has been successfully approved, and you will no longer now find that particular message or that particular alert among the alerts that we have in Nishauri. And when our patient goes back to the application, they will find that among the upcoming appointments, the date that they had requested to reschedule for clinical review will now be visible as a date among the upcoming appointments, since it has already been approved by the healthcare provider. So that answers one of the questions that had been posed by someone. So that is how the healthcare providers will be able to access requests coming from the Nishauri application to reschedule for an appointment, and either accept, approve, or decline that particular request. So with that, we'll hand it over back to John. We've been able to achieve what we had missed out with the first presentation. Over to you, John.
Thank you, Mary Ann, for that. So allow me to just recap now on the work plan. Please confirm you can see my screen.
Screen is visible. Put it on presenter mode.
All right. Okay. So we've gone through the value proposition for the application. We've been taken through navigation of the application and how to accomplish the common tasks that you will need to do. One of the emerging challenges we know with Nishauri is that one, you will need to roll it out to clients that have smartphones. And what comes with that is issues around you need to do some capacity building to our users and also to the providers, and also we need to have realistic plans. So we put together a plan that we would want to get adopted by all the partners. And this is also informed by the control deployment that was done by BOMO and also with experiences from other partners that have adopted this in the past week. So in terms of scale-up plan, we've identified a set of some 5 activities that we feel are quite integral to a successful rollout. So the first one was we felt there had to be a retraining of the partners and representatives from the facilities by Palladium on the Nishauri app. So this is what we are doing today. And with the outcome that we will now have informed TOTs who will be able to roll out this for us. So the timeline is today. And then by end of this week, we expect partners to start on some 3 set of activities. We would expect you to start with the facility level engagement and orientations. And we'd also want you to appoint Nishauri champions and also to agree certain targets with the peer educators and the CEOs from each respective facility on the number of clients that they would be seeing, that they would wish to enroll. So the outcomes of those are, of course, we will have a trained provider at site, and also the peer educators and clients will need to be sensitized. And then we will have a plan to drive the scale up by the partner, but also at the facility level. So the responsible people are in that plan. So this is the part that we are going to share with the partners. So this is the part that we will share with the partners, and so you will take it up. Please mute. Someone mute him.
Huyu anatufanya maneno.
Okay, so I can carry on. And the third activity that we figured is integral to Nishauri rollout is one that you will need to confirm the clients, your clients that have smartphones, as indicated earlier. And this will be in the course of each clinical visit. We expect you to, as part of the questions or the assessments that you'll be making, that will determine if this particular client making a clinical visit as a smartphone or not. And that will then help you determine the number of patients in your care whom you can then consent to use Nishauri application. So that will also involve talking to these clients for them to consent. We are going to see in the next slide what that involves. And of course, as you've seen, that there is need for these clients to have like email addresses, there is need for them to be supported to install the Nishauri app. So those are TAs that we expect the facility teams will be performing on the clinical visits. And of course, we expect you to sensitize and showcase Nishauri at the clinical visits or as part of the health talks that we normally have with the groups of the clients when they come for their clinical visits. A fourth aspect element that we want all the partners again to take up is on reporting. And so at facility level, we would like to know on like a weekly basis how many people have been signed up. So that there is the manual part and then there is the automatic part. So each time someone signs up, as you've seen on the portal, all the new signups are going to appear on our side, but it would also be good for you to just know at your level what is happening. You can do that by going to the portal yourself once you've signed up the clients and once they start using the system. So that will be on a weekly and also on a monthly basis. And finally, we anticipate that there will be need to have continuous application enhancement on the side of Nishauri. And as has been obvious, one of
John, please unmute from your end. Somebody must have muted you.
Okay, Marianne, am I back?
Yes, yes, you are.
All right. So I was in the last part of the scale-up plan by the partners, and I just indicated that we need to have a plan for weekly and monthly progress monitoring, and that will be available each time you enroll a client. The data is going to go into the portal, and that information will be available to you as the providers and also as partners, and also available to Palladium to judge the progress. And finally, as I indicated, we intend to continuously improve and add new features as will be requested by the partners. So the timelines are starting from today, and we anticipate the first set of activities to really commence actively by next week, and the rest of them on enrolling new people and so on will then be continuous, and then the reporting should be on a monthly basis. So turning over to a strategy, because we realized that there are certain hard questions around this. After brainstorming and also talking to the partner that had the control deployment, we've come up with some strategy around this. So the first one is about engaging and communicating and also training for the providers and the users on this. And so you will need to, first of all, as we live here, there would be need to do further refreshers to facility adherence program teams before they roll out. And next, it would be also it would also be necessary at some point to develop some communication of sorts that you will alert your clients about the existence of Nishauri, what it does, why it's necessary, and so on. So that will be on some form of information, education, and communication of this application and messaging of the same to the clients as they visit your clinics. So in terms of
Hello. Yes.
okay, so I can go on. So in terms of actual rollout, we see a phased rollout in two phases. So In the first phase, we are recommending that we start with rolling out Nishauri among our peer educators and tracers and probably CHVs who are already clients at our facilities. So the reason is one, it's an audience that we already engage with, and we anticipate that most of them probably will have smartphones as opposed to other users in our facility. So then the next point will be, once you've engaged the peer educators and tracers with smartphones, we then roll it out to other eligible clients as they visit the clinic. So you remember, as I said, each time the clients visit, we'd want you to now just confirm what type of phone they have. And if they've got smartphones, then that would be the engagement point for them to join this particular program. After that, then you'll be monitoring uptake, and in the phase 2 of the rollout, now that will be to the rest of our clients. So that should start after August, going all the way to December, and at some point we'll then review and see the progress on this. In terms of actual deliverables under there, we expect adherence program to roll out after having identified eligible clients, roll this out to everyone who is visiting the facilities. Then scale-up strategy will then be implemented. That means having rolled it out to say the first 10%, you target the next set of clients will be visiting and so on. And of course, we continue to monitor the progress on that. In the last, I just want to make a note here. So in the last part, as I've indicated, we are looking to start off with all peer educators, tracers, and mentors, and probably all eligible clients who will be visiting our facilities. The condition is they need to have smartphones and they need to have consented. We will be doing monthly progress reports as has previously been indicated. We will want to ask the partners that for each partner, you are free to innovate on any ways you can roll this out in terms of making users to accept the new application, in terms of providing technical support to your users, whether it's downloading the app for them or directing them or providing them with Wi-Fi and so on. And of course, it would also be necessary to continuously show clients how to use the app. In the last phase, so this is just a typical plan. So we expect at the partner level that you will, having gone through this in August and probably September, you will have an idea of how many of the clients you will be targeting, the ones who have smartphones and the ones who will then have consented to take up this particular app. I know this doesn't answer all the questions because it's still a novel application, but we are happy to get feedback on how best we can modify this plan. So I'd like to stop here and then request Diana to take us through the last session where we can get a few more feedback on the work plan, on the application, and also on the value addition features that we've spoken about. Thank you, and back to you, Diana.
Thanks, Ajwang, and thanks everyone for joining this call. I think from the beginning we've managed to go through the value proposition of Nishauri that was done by Moses, and also just the Nishauri showcase that was ably done by Marianne. And now we have gone through the rollout plan. So in the interest of time, I would like us to make this session to be, it's gonna be a short session. I know we may not allow for many questions. I know we have answered most of the questions on the chat, but will allow me to give like 2 people just to voice out questions, and then we can have remarks from Njoka, allow me to ambush you. I know you had taken us through your experience with the rollout of Nishauri in Bomu. Just a quick 1 minute feedback so that the other team's members can feel like it's possible, it's doable, and probably just a quick what you learned during this process for the benefit of the people that didn't join the webinar that we had on during the launch. And then I'll welcome one adherence TA from one of our partners to just also make a remark. And then I'll welcome our project director, Dr. Jacob, to also make remarks as we close. So allow me to just call out, I had seen some hands up. Francis Muema, your hand was up. Maybe you can just voice out, we can have 2 questions, and then any other question we can just respond on the chat because of we have only 10 minutes to the end of this. So maybe Francis could go first, and if there's anyone else who wants to voice out a question, you can just raise your hand, and then we'll give you an opportunity to do so as well. Anyone who has a burning question?
Thank you so much for the presentation. And my question was on the lab results. For those students with the
Go
for
ahead,
those clients
Francis.
with IVS, maybe they could a pop-up message from the system where maybe they can list up the barriers they think it has cost them to have the high viral loads. And also if they can have now the access for the ESCs to see their previous, because there are those clients with today I'm suppressed, kesho anaenda high viral load, kesho the other day ana suppress, and the other day anakuwa na high viral load. If they can have access of the barriers, so that maybe they can see whether it is a similar occurrence of the same barriers. Thank you.
Okay, thanks, Francis. So if I got your question is from the app itself, they can be able to see, they can see their viral load trends over time. So your question is if they can have more information regarding the reasons why they are having high viral load. Correct me if I got that right.
You are breaking actually.
Breaking. Adjuan, can you hear me? Adjuan, can you hear me?
Diana, you're clear
Yes,
from my end.
you're clear. You're clear.
Okay. So it's Francis. Okay. So I've had the question from Francis. Maybe we can go to the other person whose hand is up. Katsutsu. You can go ahead.
Hello? Mine is just a simple question about the specifications of the smartphones, because I know one time we were rolling out Confirm, and it could not accept some Android levels. So I think it's good for us also to get to know the specifications of these smartphones as we recruit our clients. Thank you.
Okay, thanks for that. Kevin?
Yeah, thanks. So the Android version, the lowest Android version is version 7. So we support Android 7 and above, which is pretty low, which means a majority of the phones should be able to install Nishauri. For the other specs, yes, they will have an impact in terms of the speed of the phone and also the access to the internet. Over.
Thanks, Kevin. There was another up. That was the last person I wanted to give to ask a question, but I think we should be good. Steve, let me allow you to be the last. I hope you'll be brief.
Allow me be brief. Thank you. Thank you. Mine was on the integration bit, back to it, on the integration bit of it. In regards to appointment scheduling, rescheduling, then I saw the information goes into Ushauri. My comment, or I was looking if there is a way we can have it goes into the Kenya EMR. Now that is where we manage all the clinical bit of these clients. If that can be worked on, then because you will find that most of the time, Ushauri is not found, the current nature, you will not find that Ushauri is to all the clinical team, but you'll find that they will be able to open Kenya EMR day by day just to ensure that they can as well receive this kind of information. Thank you. I've tried to be brief so that I avoid the others. Thank you.
Yeah. Thanks, that was clear, Steve. So I think we'll stop from there. Kevin Lanyo just confirmed that once the clinician accepts a reschedule, that message will go back to Kenya EMR and they'll get the updated list from Kenya EMR. Just confirm that.
No, that's not what will happen. So the clinician will be notified in Ushauri. Once they accept, they have to log into their EMR and actually change the application date, the appointment date. When the appointment date is changed in the EMR, then it is again shared through the integration to Ushauri and also to Nishauri. I hope that explains. Over.
Okay.
So Diana, in
So maybe the
regards to the
question
same,
was, okay, go ahead.
maybe in regards to the same, with the current practice, we don't, from the experience I have, you'll find that the clinical team do not open all this application at the same time. Can we just try do something in regards to the same? You'll find that they don't open Ushauri, but
Yes.
as compared to Kenya EMR, they open Kenya EMR all the time.
Yeah, that's my explanation, Stephen. So currently there is a data exchange between the EMR and Ushauri. You do not have to do it twice. Once you do it in Kenya EMR, the same appointment you've changed the date for will be automatically transmitted to Ushauri and Nishauri. Over.
So maybe the question was, Kevin, once it has been changed from Ushauri, the clinician has accepted, will that message go to Kenya EMR with a new date? I think that was a question.
No, it will not. Over.
So maybe it's something that we can think around and see how to have that, have seamless integration. So thanks, Steve. It's something that we can look at internally and see how best to ensure that it's seamless. And you're right, yeah, the person that is using Ushauri may be different from the clinician at the CCC. So allow me to stop the questions there. Njoka, would you want to just give a 1 minute experience and then we can just give one adherence tier and then we can give Dr. Jacob and then we can close. Is Njoka in the call?
Thank you, Diana. Yes, I am there. Can you hear me?
Loud and clear.
Diana, can you hear me? Okay,
Yes,
thank you for the opportunity. Sure, thanks. So 7 quick tips. One is as we try to implement this, we need to rethink our clinic flow for Nishauri. And by this, I mean you need to think about who is going to be doing what in terms of supporting Nishauri enrollments. So you might probably need to allocate tasks to different people to perform different responsibilities so that there is a defined way or there is a structured way for implementing this. Otherwise, if you just leave it like that, then nothing will happen. So rethink how the clinic is flowing, how your clinic flows. Are we supposed to be doing what? Allocate tasks so that people are responsible for particular responsibilities. Ensure that you're conducting client education, like you mentioned, so that people are sensitized on the value proposition for Nishauri. and probably have a structured message that the people that are enrolling the clients will pass to the clients. Hatutaki kupatia mtu hiyo jukumu alafu sasa hata kuexplain kwa clients ni Nishauri ni nini, pengine hawezi. Kwa hivyo itakuwa ni vema kama tutakuwa na some standard message that you expect the person that is doing the enrollment for Nishauri to pass to the clients, so that we have at least some standard message being passed out. Don't forget the consent, clients, either verbally but written on paper, so that when they come to the clinic, they're able to sign on the forms. Again, so that we are on the safe side of the law and things. So make sure that you seek consent first. Ensure you have that documented, so that you can be able to do this. Then internet is the paramount. I'm sure most of the clients that will be coming to us might not be having internet bundles on their phone to download the application. And for you to score, then you probably need to give some quick bundles or internet access for the client, so that can be able to do the installation. If you don't have that, probably you can have the application. You probably have the application at hand, so that you just need to share that with the clients, so that you can be able to install and do the configuration. You also need to you have some ensure that you have access. The person that is doing the enrollment has access to Kenya EMR, has access to the Nishauri server, and also they have access to the Nishauri mobile application on their phone. This is important because you might find there are instances where you're trying to log a client and you're getting errors because the mobile number that you're using is different from the one that Nishauri, or even the name that you're trying to use is different from what is in Nishauri. So you need to have at least Kenya EMR with you, so that in case you do any changes in any of the systems, then you make sure that the same reflects in the multiple systems that you have. So if you change the mobile number in Nishauri, make sure you change Nishauri, make sure you change the same number in Kenya EMR. So you need to have access to the systems at all times, and specifically for the person that is going to be doing enrollment. Don't forget the TI clients. Where you get TI clients, you need to transfer them from the Nishauri on your mobile, the Nishauri application on your mobile phone. So make sure you transfer the clients to your facility, so that you can be able to access their information, and especially if they are already enrolled in the facility where they came from. We have good support of Palladium help desk. In case you get stuck, don't feel like you are alone there. Make sure you contact either your SI in your IP for the IP that is helping you out, or to Palladium help desk, so that you're able to be assisted quickly with the issues that you're facing. And then always make sure that you're monitoring your daily performance, so that you can be able to see the progress that you're making. And I think Bernard has shared with us a template that you can innovate, so that you can definitely be in touch with the issues that we are facing and the numbers that we are enrolling in the system. So then in the few minutes that you've given me, I think that's what I can share. Thank you.
Thanks so much, Njoka. I believe we have gotten lessons learned from Bomo. It's doable. And I believe most of us in the call, we have peer educators. I think if we can start from us, I think that would be, and trace us for some facilities. We can start with practicing from our side for the people that are eligible, that's the people who have smartphones, and taking care in those facilities. If we can start, it would be easier. It would be easier to also orient the clients as they come for their clinics. So I don't know, I don't seem to know the names of the adherence TAs from the partners. So if you are an adherence and retention TA from any partner, please feel free to just unmute and just speak on behalf of the partners. I had seen Wandina. I don't know if he's still on the call. Any adherence and doesn't have to be TA, adherence and retention team from the partner side. Please feel free to unmute. Go ahead.
I'm Joan Baja, adherence counselor of Nuri Mtoto project, Kakamega.
Okay, maybe you can just from the meeting today, your takeaway message and how you will support this process as the program team. Yes, Samburu. Samburu, your hand is raised. You can just unmute. Or was it by mistake?
Good afternoon.
Okay, good afternoon. Go ahead. Lauren, if you're talking, go ahead.
Yeah, I'm Lorena Mig.
Okay, looks like we've lost Lauren. Alfred Juma, maybe you can go ahead.
Yeah, so good evening, John. Thank you for
Hello.
this opportunity. Alfred Juma from Technical Officer the Nyeri on behalf of the technical advisor. Thank you so much for the good practice, especially what has been shared about BOMO. So my take is that we are going to roll a plan on implement the same. First in our strategy will be maybe the peer educators and then the clients who will be sensitized to do the same. I believe this is possible, especially now that we are leveraging on technology as an IFADI pillar. Thank you so much.
Thanks, Alfred and the program team. We are counting on your support to ensure that this is successful and also that the team at the site will benefit from your support as well. So please allow me to just invite two people, then we close. I know my colleague Kezia, who is usually the representative for the users from the Palladium site. I don't know if you can just say something about the feedback that you've received from the users from this call and commitments that we are making in regards to the requests that have come from this session. And then we can have Dr. Jacob close it for us. Kezia?
Thanks, Diana. Good afternoon, everyone. Thank you for making time for this. We really appreciate you taking time to just listen and just have a look at what we have for you and in place for the patient. So this being a patient app, we are really counting on your support to ensure that we sell it or we orient our patients on on the value it will add to their care. So we've received your feedback, very valuable feedback, and we'll be working on it. And even as you interact with it, I believe from this, we are going to have these used in our daily activities. As you interact with it, as you find out more about it, keep the feedback coming through our service desk, even those individual phone numbers that you have. Use any channel that you could use let us know of how best we can support you and how best we can make this app work best for our clients. We are all working towards having improved health outcomes and supporting our patients in receiving the best care that we could. So let's work together on this. And we can only do that if you give us the feedback. We rely on that feedback to improve on the solutions that we have. So kindly keep it coming. We really appreciate your support. Thank you.
Thanks, Kezia. Would like to welcome Dr. Jacob Odhiambo. Jacob is the project director for the Kenya HMIS project. So kindly, Doc, kindly give your closing remarks and close the meeting officially.
Yeah, thanks Diana and team for organizing the meeting and the facilitators for taking the participants through the session. I'll just give maybe 3 main points. So the first one is in our in our direction to go patient-centric. We would like to empower both the provider using Kenya EMR and the applications that align with it, but also empower the patient to have control of their own records through Nishauri. And that's the basis on which we are doing this work. As you notice that this will support both HIFADI, but also the third 95, which is around viral load suppression, but also strengthen how the patient engages with the system. The second comment is about scale up. I like the idea that we can start with the peer educators so that they can be able to, first of all, give us feedback. So we are really looking forward to feedback. If the partners can facilitate that feedback to come, it would be very ideal. But then the second part of that is then the knowledge they acquire, they will be better empowered to engage with patients who they are enrolling into the platform. When you have enough information, then you can be able to pass that because you can't really pass out what you don't have. And then the third one is requests for improvement. Even during this meeting, I've seen the request to make sure that updated appointment requests can be sent to Kenya EMR seamlessly. And I think those are the feedback that we are looking for. As you use the application, you'll realize that there will be more definitely coming. The Android users are favored over the iPhone users. And then I've also heard the need to add more alerts in the application. So I think these are some of the feedback we are looking forward to getting more of from you. Because this is not the end, the final application. What we are looking for is to continuously improve it so that it can serve the interest of the patient and the provider. Otherwise, I think, Diana, that's all from me. It's just to now, give you the space to scale up and give us feedback. I think having said that, I'll just maybe, propose that we adjourn the meeting and give it to Diana for the closing, formalities. Diana.
Thanks, Dr. Jacob, for those wonderful remarks. So I believe we have gotten our commitment as Palladium to just work on the feedback from you. So I know we have the mHealth WhatsApp group. At least let's have a representative from each facility part of it. I would want to request maybe Ajwang to just post the link so that we can have other facilities join that group. I'm not sure of the limit number, but we can have first come, first serve so that we can just join that group. If there are any questions, we are free to ask from there. I know we had also posted the service desk number. Maybe Philemon, you can still repost for the people who didn't see. When you encounter any challenge, feel free to reach out to us and we'll be able to support you. Otherwise, I think that's it for today. We're sorry we've gone beyond the set time, but I hope the session was helpful to all of us and we are going to implement what we have learned. We'll be doing this monthly monitoring, as Ajwang had mentioned. So just catching base to see progress per partner, per site, how we are doing. And if there are any blockers, we will be able to unlock those as well. So Ajwang has posted the group for WhatsApp for mHealth. So if we can have a representative from each facility join so that we can also discuss from there. But also if you reach out to our service desk, we'll be able to support. So thanks everyone. I know we started with a word of prayer. I don't know if we can have someone end it with a word of prayer. Ajwang, anything I've forgotten?
You've covered everything.
Okay. Maybe someone to pray for us as we close. Any volunteer? Okay, let me volunteer, Juan.
Okay, so let's believe and pray. Father, we thank you for having guided us through our meeting. We thank you for the wisdom and knowledge that we've gained. We pray that as we go forth to implement this application, that you will guide us, all for the betterment of your people. I pray this shortly, believing in the name of your Son, Jesus Christ. Amen.
Amen. Good evening, everyone.
Enjoy your evening too.